Hello, I am Puya Hamami, a healthcare analyst at Edison, and I have prepared a comprehensive report on the emerging development pipeline in age-related macular degeneration, or AMD. Altogether, the healthcare sector has the potential to robustly outperform the market over the next several years, especially in light of COVID-19 and slower overall economic growth and the low-yield environment. Within healthcare, we have identified AMD as an area of particular opportunity since it tends to receive less media coverage and analyst recognition than most healthcare areas. As people increasingly seek and expect to maintain their functioning and quality of life as they age, there is an overwhelming demand in our view for treatments to decelerate or prevent vision loss in patients diagnosed with AMD. AMD is the leading cause of blindness in older adults across Western countries, and we estimate it affects about 25 million older adults in the US and Europe. Of these, about 10 to 12%, or about 2.8 million people, suffer from wet or neovascular AMD, whereby new blood vessels grow into the eye, and if untreated, this can quickly lead to legal blindness. Wet AMD is currently treated by anti-VEGF injections such as Eylea or Lucentis, and we estimate that between these two products, they record over $5.7 billion in annual sales just for wet AMD, and that itself is growing at about 9% per year. While anti-VEGF drugs are good at stabilizing wet AMD and preventing further vision loss, they do require recurring intraocular injections every 2 months or so for most patients, and this is cumbersome and can lead to compliance issues. So we think that there is a tremendous opportunity for candidate treatments that can reduce the treatment burden or injection frequency. In our report, we look at companies that are looking at ways to extend wet AMD treatment durability. Roche has 2 late-stage candidates, faricimab and its port delivery system for ranibizumab. In addition, we discuss Kodiak's pivotal stage KSI 301, which may reduce dosing frequency to every 6 months. We also review alternate mechanisms, including gene therapies that can provide extended treatment durations of potentially up to a year, as well as candidates targeting non-VEGF-A mechanisms to provide options for those who are refractory to current treatments. Finally, topical and oral non-invasive drug treatments are also discussed, and these are in development for wet AMD. If they are successful, we think they can go a long way towards improving treatment compliance. But in our view, the truly untapped frontier for AMD lies within the dry AMD market, or more specifically, in late-stage dry AMD, also known as geographic atrophy. Over 22 million patients in the US and Europe have the dry form of AMD, for which there is no widely accepted approved treatment. Dry AMD progresses much more slowly than wet AMD, but it can still cause debilitating vision loss in the late stages, which we estimate represents roughly 2.7 million patients in the US and Europe with geographic atrophy. Patients with geographic atrophy remain at risk of further vision loss affecting their independence, and we estimate that the market for a treatment that can be shown to decelerate vision loss in these patients can potentially approach the size of the current wet AMD market. In our report, we discuss several late-stage candidates having already shown clinical data suggestive of disease deceleration, including Apellis' APL2, Iveric's Zimura, and Allegro's Luminate. Other candidates, including oral treatments, cell therapies, and light-based therapies, are also discussed. Altogether, we expect that the next 5 to 10 years can be potentially revolutionary in the dry AMD segment that up until now has had little to offer to patients beyond dietary supplements and lifestyle modifications. We also discuss Pixium Vision's very promising Prima Bionic Vision System that aims to deliver a form of prosthetic functional vision to partially replace the natural central vision loss in patients with severe geographic atrophy for whom the majority of their underlying photoreceptors in the central area has been irreversibly impaired from the disease. As a whole, given the pipeline, the outlook for prospective patients and the industry for both dry AMD and wet AMD appears very promising, with blockbuster-size revenue opportunities for products that can improve outcomes in this space, or in the case of wet AMD, at least deliver improved convenience or treatment durability versus the current standard of care.